Okay, there it is. We're starting it. Okay. Oh, I forgot what I was saying. Okay, so I looked at your ears. They're the external auditory canal has hair and mild cerumen in it. The tympanic membrane is a pearly gray and doesn't show any bulges. The cone of light in the right ear is at 5 o'clock and in the left at 7. The umbo malleus and the pars flacida, which is above the pars tensa, are all visible and freely visible and noted. Also, I want to add that there was no signs of lid lag or ptosis in her eyes. Check your eyes for activity to light. Okay. All right. Just keep your eye open. Okay. All right. The Okay, just follow this. Like, look behind me, and then when I tell you to focus, I want you to focus on it wherever I move it, okay? Alright, now focus. Okay. Her pupils are round, equal, and reactive to light, and they have accommodation bilaterally and consensually. Let's see. Alright, I want you to follow this with your eyes. Okay, good. I just tested for the 6 cardinal fields of gaze. I want you to, the corneal clarity was clear. The position of globe was symmetric and showed no signs of nystagmus. I need to check your red reflex. So I'm going to shine this in your eye. It will, yeah. Okay. The red reflex is present. Normally you check it with the lights off. You can see it from a distance. The retinal background was noted along with the optic disc. The fundus is like a yellowish color. It has a lot of vessels, arterioles and venules. The arterioles are brighter and they have a ratio of 3 to 5 or 2 to 3, and the venules also did not show any crossing or nicking. If you followed the optic disc nasally, then if you follow it nasally, you'll come to the optic disc, which is 1.5 milliliters in diameter. Is round and almost like a frisbee shape. Did not show any signs of glomatomatosis, or physiologic cupping. Then if you follow that temporally about 2 disc in diameter, you'll come to the macula, which is avascular, and which is gray in color, almost round. In the center of that is the fovea centralis, which is the center of vision. Okay. I would also do for the eyes the Snellen test, which is what they do whenever you're at the eye doctor, whatever they have you see from about 20 feet away, see certain lines, you can tell your vision on that. Then the Rosenbaum also tests for your reading and near vision. You read cards that are 14 inches away. And then also we need to as far as the corneal clarity and the position of the globe is, if it was not equal, then we would do the cover test. So I'm going to use her as an example for that, even though hers was equal. I want you to cover your right eye, all right, and look to your left. Keep looking to your left and uncover that eye. Okay, and as you can see, both of them stayed looking to the left, so hers was normal. And then the confrontation test. So I'm going to have you cover that right eye again, and we're going to play a game. I want you to tell me that when you see, this is the bunny. I want you to tell me when you see the bunny.
I see it.
Okay.
I see it. Yes. Yes.
Okay.
Yes. 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 Yes.
Okay. You can uncover it now. I would do that bilaterally. The nose, I want you to push one nostril in and take in a deep breath. Alright, now I'll do it to the other. Okay, good. I would also have her smell something. They use cinnamon and vinegar in the videos. Basically, you have them close their eyes, and you would ask them what the smell was. And the first smell would be like a sweet smell, something like cinnamon. The second smell would be something in contrast, like vinegar. And that tests for the cranial nerve, olfactory cranial nerve. Okay, so for hearing, we're going to do the Ryan and Weber test. So I want you to just, I'm going to hit this and put it on top of your head. You tell me if you hear it in both ears, or if not, which ear you hear it in, okay? And tell me when it stops. Okay. This is the other test. You tell me when it stops.
Okay.
You still hear it?
Nope.
Stop. Okay. All right. So air conduction is greater than bone conduction, which is at a ratio of 2 to 1. Also, we're going to do the whisper test. So I want you to occlude one ear and then repeat back what I say to you.
I love nursing.
Most of the time. Okay. So that was correct. Let's see. So the hearing. Okay, the smells, the tastes. Okay, so we are also going to, let me ask something I didn't do. I did not palpate her mastoid process. Is there any tenderness there?
No.
Okay, good. All right. So I am going to do a test to touch. It's one end is going to be as a Q-tip, one end is a sharp end, one's in a soft end. And you just close your eyes and tell me which one you feel.
Sharp. Soft. 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 Sharp.
Okay. All right. Good. I'm now gonna look in your mouth, at your teeth. Okay. Say ah.
Aw.
Okay. So the uvula and the posterior pharynx was midline whenever it was when she said ah. The tonsils were at a +2. The tonsillar pillars were also noted. Let me look at your tongue. Raise it up, like underneath. Yep. The sublingual area is very vascular. Her teeth are white. There is some evidence of fillings, but no dental caries. Let me count your teeth. Sorry, it's kind of white for me. Do you have your wisdom teeth removed?
Uh-huh.
Okay, so she has a total of 28 teeth, and she has her wisdom teeth removed, you can tell. I'm also going to touch the roof of your mouth. Okay, so the hard palate is rigid and continuous with a soft palate. Her gums were pink, and there's no receding, as you can tell. They're moist. Is there any tenderness in your gums? There's no ulcerations or calcifications. Her mucosal was pink and moist, and no ulcerations or calcifications. Or lesions. Okay. So can you stick your tongue out and move side to side? Okay, all right. Her tongue, on the dorsal aspect of the tongue, it has it's very well papillated, and the lateral aspect is, or the lateral sides is smooth. Also, testing for cranial nerve 9 and 10. Whenever a person would be, it was demonstrated by her swallowing, gag reflex, speaking, and when the uvula remained midline as it rose and fell. Okay. Okay. So I'm going to palpate the lymph nodes. This is preocular, postocular, occipital, submandibular, submental, and this is sublingual. You have the anterior chain, the posterior chain, the deep chain, and this is the supraclavicular. All nodes are not palpable. If they were, then I'd note whether they were freely movable or concrete in the size and the symmetry of them. Are you having any pain in your neck at all? Feel your cervical spine here. That's good. I'm going to have you raise your chin and swallow. Okay. And do it again. Okay. Her pharynx remains midline as she's swallowing. Her neck is symmetrical. No signs of deviation or anything. It remains midline. It's upright. Also, her head is normal cephalic. It's atraumatic. It's symmetric in midline. It's upright, and there is no involuntary movement or tics. To get back here, I'll check your thyroid. Okay. Have you swallowed for me? Okay, lean your head to the side. All right, other side. Okay. Her thyroid gland is purple, but there's no nodules or any calcifications noted. Her carotid, you can see a slight pulsation. There's no JVD notice, no distension. I'm going to listen for a brewery for the thyroid. Okay, and there is no brewery noted. Let's see what to do first. Okay, so put your chin to your chest. All right, move your head from side to side, roll it to touch your shoulder. All right, now roll it to touch your other shoulder. Okay. Tilt your head back. Is there any pain at all when you do that or difficulty? Okay. So I'm gonna test your cranial nerve for the spinal processes. So I want you to shrug your shoulders while I'm pushing down. Okay. All right. So push it against my hand while I'm pushing. Okay. Other side. Okay. And everything was within normal limitations. It was strong. There wasn't any weakness there noted. Sorry, I'm trying to think. Make sure I'm covered. It's a lot to cover. I feel like I'm missing stuff. The hair distribution is even for a female. She doesn't have much hair on her arms at all. Do you shave? Like your legs or anything?
Oh.
Your legs, okay. There was no signs
They were
of, yeah, they're dry, but no signs of folliculitis. Let's see. Just going through everything in my head. Okay, so neck, we did range of motion. We checked all that. I did your nodes. I had you swallow. I checked your thyroid and your carotid. TMJ. Maybe something else is for you. Okay, and your facial nerve. Okay, so let's do the facial nerve first. So, I'm going to have you smile with no teeth. Smile with teeth. Purse your lips. Puff your cheeks. Frown. That's fun. Tongue in your cheek. Okay. So close your eyes. Raise your eyebrows. Okay. All right. Now squint while I'm putting pressure. Okay. Good. Now let's do the TMJ. So, open your jaw. Okay. Open wider. All right. Move your jaw from side to side. Okay. Don't you hate those? Okay. Move your jaw to the side. Let's see. Push your chin. Yeah. Push your chin out and against resistance, and then out again. Push it out again. Okay. Clench your jaw. Okay. Good. All right. There's no pain, no tenderness. Right. No tenderness. No clicks or pops noted. Everything I saw from the eye, and I saw in Let me take her blood pressure now. Okay, 126/78. Okay. Did all that. She's sending a test for the tag one. Did we solve? No. I think it's better. I really do. Okay. Alright. Let me see what I missed.